Early tomorrow morning, I have to drive to my mum's funeral. She died of a broken system. Not a broken biological system. I mean the broken food system that surrounds us, that confuses us, that misleads us, and the broken healthcare system that makes mistakes because it's dangerously overstretched and overwhelmed because of the pressures put on it largely by the broken food system. Now, in the 1990s, the dim, distant past, I was a sport and exercise scientist, young, enthusiastic, running a successful health club chain, set up one of the first NHS GP referral programs connecting patients with fitness instructors. And my colleagues and I, we firmly believed that we were going to produce healthy nations by telling everyone to eat healthily and do exercise. Absolutely believed that because the science said so. On paper, that is what happens if you do those things. Well, fast forward to 2018, and I could already start to see the cracks in this dream. I plotted 50 years of diet and fitness revenues, which over 50 years had grown. On the same 50 years, I plotted average waistline size, which had also grown. The same 50 years, I plotted chronic physical and mental illnesses, which had also grown. So over the past 50 years, as the diet, fitness, and wellness sector has grown, so has the scale of the health crisis. And yet, we are still giving the same recommendations that we were in the 1990s, even though they clearly don't work. Why? Why have we not changed this model? It makes no sense. We are using a flawed health coaching model. It is still given as best practice today. Now, once I had seen this, I could not unsee it. And I managed to persuade some forward-thinking investors to give me some money, so I could go on a research mission to forensically examine why this does not work and why on earth we're still telling people to do it. And after going down many, many rabbit holes, the size of a warren of rabbit holes that included, is it gut health that we should all be doing? Is it biological age testing? Is it supplements? Is it functional foods? Is it wearables that we should be using? Is it a myriad of digital health apps? I looked at them all. And in every single case, one problem kept emerging over and over and over. And that is the fact that we all start these things with great intentions, and then we fizzle out before the brain has had time to wire that new behavior. The health coaching model is ignoring something that happens in the brain, a biological process called long-term potentiation. And this biological process is slow, it needs repetition over many months. You can't sidestep it, you can't go around it, you can't shortcut it. If I wanted to plant a rose in my garden, I could go online, do it on my phone, could order it right now. Buy a rose at rose.com. It would be delivered tomorrow. But then when I put it in the garden, the network of roots don't suddenly explode out of the bottom of it into the earth. I will have to nurture that rose. It will need attention while the roots slowly grow, they slowly develop, until eventually it will be established and it will no longer need my support. It will survive with rainwater and just the natural environment. Habits don't just suddenly emerge. They need frequent repetition, preferably daily when you're trying to adopt a new habit, for many months. So the real problem that we're facing is actually retention, which the diet and fitness industry has grappled with for decades. People join, they're really enthusiastic, especially in January, and then they fizzle out. So this is the problem that we should be focusing on if we want to change the traditional, typical health recommendations. Because we know that just giving people a list of recommended habits and then expecting them to magically somehow go away and create those habits themselves in a crazy world that we live in, with just maybe one coaching session a week, if you're lucky. So what is it that helps people keep going longer? If we know that this biological process takes time, and it needs time, every time, if this is a brain cell, every time you're repeating that habit, molecular changes are happening in that brain cell. There are structural changes that take place, with molecules being transported from the cell body out to the outer membrane of the dendrites, making that cell more able to receive neurotransmitters from brain cells nearby. This is the process of forming networks of neurons and creating new behaviors. It's what keeps us alive. It gives us the ability to adapt. But it's slow and it takes time and it takes repetition. So when I looked at it, okay, so how do we keep people going longer? Humans. We've always known if you give someone a human coach, then they keep going. But humans are expensive. So over the years, especially over the past decade, we all lurched towards digital fitness and digital health, digital apps, the digital health solution, believing that a tech nudge could have the same power as a human. Well, we can see from the retention figures of the digital health apps that they don't replace humans. Humans respond best to humans. So last year, as my investment funding was fast running out, I launched one final pilot because I wanted to identify the minimum effective dose of human support. How much human connection do you actually have to give someone to result in them keeping going with you? I set up a pilot, 90 participants, and I acted as the accountability buddy. And all I did was ask them to pick one health habit to start working on and to try and do that habit every day. And I said, I will show up for you as your accountability buddy. And I'll send you a WhatsApp message every day asking you if you've done the habit. And that's what I did every day. It's like, hey, how you doing? It's been busy today. I've been doing a TEDx talk today. Did you do your habit? Let me know. And they just had to reply with a thumbs up if they had done the habit that day, or a heart if they hadn't been able to do the habit that day, but their heart's still in the challenge, and we'll check in again the next day. And I built a prototype platform so that I could just send one message, and that platform sent it as a private WhatsApp message to every single participant, collected all of their thumbs up and hearts, and gave them a weekly score, a weekly check-in score. Really light touch. Not a scientific quote that I sent, or a motivational quote, or a scientific fact. The best responses I was getting when I was just talking about my daily life. It's like, wow, I'm a bit late with my message today because I had to take my dog to the vet. How are you doing? Did you do your habit today? Just real human-to-human, ordinary stuff. At the end of 12 weeks, 69% of those 90 participants were still regularly responding to my daily check-in. That is a lot. And then I had to patiently wait a year, which is really hard because I'm not patient. And 12 months later, I contacted them and said, it's been a year since we were doing the daily check-ins. Are you still doing your health habit that you chose? And 7 out of 10 of them were still doing the health habit that they had chosen. So, in a world where we're now spending hundreds of millions of pounds and dollars and euros on complicated solutions to the health crisis, which is largely being driven by behavior change and people's inability to form permanent health habits, the answer was embarrassingly simple. We just need to give someone a human buddy and check in every day with a simple light touch. Did you do it today? Yeah, still on it. I'm still on it. I'm still with you. The humans got pushed to the background, and we pushed tech to the foreground. But now we have the technology to push the humans back to the front. And that's how I think we need to start thinking about updating the health coaching model. So it's not just here's the list of recommendations, see you next week. In between those weekly touch points with that coach or whoever it is, the nutritionist, whoever it is you're working with, we need to add the daily check-ins so that there isn't that tumbleweed gap in between where people drop out. The future of health coaching is human. Thank you for listening.